My name's Derek Moore. I'm an orthopedic surgeon at the Longstreet Clinic. I've been in Gainesville now since 2004. Ortho TLC has an integrated solution to workers' comp injuries in that we can take care from the initial injury through the diagnosis, treatment, rehabilitation. The difference that we see with workers' comp injuries is instead of just being the physician and the patient, we also have the workers' comp coverage with that, which is usually the employer involved. So we deal not only with the plans we have to rehabilitate the patient, get them back to full activity, but in doing so, we're communicating with their employer to let them know the restrictions they have, how long we think it's going to take, what accommodations would be helpful if we can find a position that may be less stressful to them while they're recovering so they can keep working while they're trying to recover. I think the thing that Longstreet Clinic does differently with workers' compensation is the fact that we can bring someone in, we can diagnose them, we can between our various physicians here, we can get them treated, whether this is an orthopedic injury with arm, leg, if it's a neurosurgical issue with a spine, if it's a general surgery issue with hernias. We have all of those here. One of our advantages working with workers' compensation, when I first started 12 years ago, we had individual nurses trying to work with the adjusters who are the people who work with the employers trying to get workers treated, taken care of. And because of that, it was difficult to get in contact with them. So we went to a system where we now have two people who are dedicated to coordinating with the workers' compensation. And the good thing is, since they do this constantly, they're on a first-name basis with a lot of these adjusters and a lot of the employers. So the people who are calling, and saying, we have somebody who got hurt, what can we do? We're able to work that through, and they'll often just slip them into my schedule, either that day or the next day if they need to, so we can take care of them quickly. When someone's been injured, the first step is obviously diagnosing that. So we look at it, we try to decide, is this an injury that we can rehabilitate either through rest, through some supervised exercises, or is this something that's going to require something more to diagnose that, whether that's an MRI, some nerve testing, x-rays. We can run through whichever of those we need since we have them here. Afterwards, we work on the treatment plan, whether that's planning for surgery, in which case we go through that with the injured workers. We work with their employers to let them know what the plans are, what they're going to require, roughly how long we think it's going to take to get them back to their regular work, and then we make sure that happens.